Right, good evening everybody. Welcome to the first of our First 5 Locum support events, which we're calling Locum Challenges during COVID-19. And so welcome to so many of you, and I'm really glad that you could come and join us this evening. Without further ado, we'll start to move forward. First thing I'd like to do is hand you over to our First 5 chair, Dr. Ian Wood. Welcome, Dr. Wood.
Thanks, James. Reminder on that photo of the difficulties of getting a good haircut during COVID-19, so please excuse my look. Hello everyone, welcome to this evening's webinar hosted by the Royal College of GPs. I'm Ian Wood, National First 5 Chair. Tonight, as James said, is the first session to be hosted by the First 5 Committee. Tonight we'll be looking in some detail at the unique challenges that are facing our locum GPs during COVID-19, as well as the threats to their well-being and support. Why is it so important to the First 5 community? Well, locum roles are a key part of many of our careers, either as a sole entity or as part of a portfolio of work. And as such, it makes up a really significant proportion of the First 5 membership. I think on last count, it was as many as 50% of us have some degree of locum work in our roles. We're keen to continue ensuring that the voice of First 5 GPs resonates strongly throughout the college. And with that, championing the unique role that locum practitioners had to play during the pandemic. Tonight we're talking about challenges and support for First 5 GPs, but we do plan to have a series of webinars focusing on locums and locum work. So if some key themes come out of your questions or our discussions tonight, they will help to inform what we go on to discuss next. So please do get involved. I'm going to shortly hand over to Azza and James, who are going to introduce the session. As always, my door or inbox at the moment is always open to any of you. If you have questions or concerns you feel unable to raise here. And similarly, at a local level, all of your First 5 representatives are doing a fantastic job of making your voices heard. Please do reach out to them. There are many more First 5 specific webinars coming up, so please do keep an eye on the website. And there are topics or issues which you think may be worthy of wider debate. Please let us know either through email or on the members forum at the RCGP. On that note, please do take some time to check out the debates currently going on the forum. It's a great new resource being led by Amanda Howe, our president, alongside the wealth of information and CPD on the dedicated COVID-19 section of the website too. Without further ado, I'll hand over to Azza and James to introduce our panel and get this evening's webinar started. Thank you.
Well, thank you so much for that lovely introduction, Ian. So just to move on to introduce ourselves. First off, and who are we and why are we here? My name's James Waldron. I'm a GP practicing in Nottingham and the Vale of Trent First 5 co-lead, as well as been a locum relatively recently, but involved quite heavily in new to practice in the local area. So really involved with the things that are going on at the moment. And so handing over to Azza.
Hello, I'm Azza Elghonaimy. I'm the First 5 lead for Yorkshire, and I'm currently working as a part-time locum GP. James and I are the First 5 community representatives. So what's this evening about? So this is our first webinar of a series which aims to support locum GPs who represent a large core of the First 5 workforce. We decided to organise this webinar after receiving feedback from our peers nationwide with some of the challenges that they have been experiencing during the pandemic. This includes work market for locums has become complex, variance in work available, variance in conditions worked in, with a number of stories of poor practice.
And so what is this evening about? Well, the evening is about finding help and support for you as the locum workforce, and particularly the First 5 aspects of this. Tonight is going to be about practical advice about how to practice to ensure we have safe and fulfilling practices, safe and fulfilling work lives. But this isn't necessarily meant to be a forum for specific grievances or worries about the politics around us. There are many other forums to contribute to that, but we're really focusing on what we can do to help you through this difficult time. We're going to be looking at fact-checking and advice of what we can be expected to do and what we can be expected not to have to do. Advice on money, advice on rates and setting those terms of business. ways to keep up to date with things that are changing constantly and in an ever complicated world of both clinical and practical aspects of working as a GP and a locum GP. Learning about what we're doing now and about how we can look to the future and how we can develop that moving forwards. Looking at how to identify and create locum support groups and support for us as we move forward. And also trying to ensure that we are resilient and strong practitioners, and that we can rely on each other for support. So this is evidently a live function, and we're looking to have input from people, but it should be available as a recorded entity afterwards, so that it's available to all. So if it's been good for you at the end, please spread the word and share this event. So tonight we're really pleased to bring you a really wonderful panel of some experts in the field, especially of locuming and of people in our particular situation. So I'm delighted to be able to bring you Dr Surina Chibber, who is a co-founder of My Locum Manager, a portfolio GP, a 3-time Pulse Power 50 GP for supporting the locum workforce, and a mum of 2 who's taken some time out of her evening to join us today. So welcome, Surina.
Thank you, James. Hi, everyone.
And following Surina's talk, I'm also pleased to present today Richard Fieldhouse. He is the founder and the chairman of the National Association of Sessional GPs and IT platform Locum Deck. He will be speaking, and he will finish off our planned talks before we open it to you for questions.
Hey everyone.
Hello. Welcome, Richard. So, how things will work today, hear from each of our speakers in the ways they can offer support and some of their thoughts and approaches to the issue. Surina and Richard will share their experiences and knowledge with us, followed by questions. And then we really want to hear from you and answer your questions.
Yeah, we know this is a really complex and variable time. And so it's important that we get the views of the people that matter the most, which is yourselves. So there's lots of ways to contribute. We've taken some of the questions and some of the themes off the forum, which have been very, very busy. But also, if you look through here, so we're running this as a webinar, which means that wouldn't usually be sort of voice chat or video between people apart from the panelists. However, you can contribute and ask questions with the Q&A function. I will endeavour to get to as many questions as we can, and anything that we can't, we'll certainly bring up later to make sure that we're addressing things.
We aim to keep this an easy flowing event. The college is keen to listen, help and support you. So if there are any frequent themes that emerge and we don't have time to answer them today, we will endeavour to address them. We may consider them for use in a future webinars in our series. Please feel free to feedback your thoughts, opinions and wishes for these future webinars.
So without further ado, I'd like to hand over to our first of our speakers, Dr Surina Chibber. Thank you.
Hi, everyone. Thanks so much for having me. I'm delighted to be here, and I really hope this session is as useful as possible for everyone that's attending. I've just put together a couple of slides, which I'm going to use to kind of share key points. So the first one is a bit about me. I am a portfolio GP. I'm a mum of 2, who the 2 that I speak of are currently let loose upstairs. So let's hope we don't get any interruptions. I also, alongside my clinical work that I do as a locum, I work in GP education. And probably my biggest role is I'm co-founder of My Locum Manager, which started as a platform to connect locums to networks of practices and as centralise all their portfolio roles, and has since developed into something that practices and CCGs and federations use. I'm also, My Locum Manager is a RCGP Plus member. I write for Pulse. I'm involved in undergraduate teaching. But as a locum GP myself, I've been very much affected, as have all locums, by the current issues. And I just wanted to share a couple of resources and tools and tips to hopefully give you some strategies for going forward. So just to give you an outline, of the key things I'm going to talk about. So point one is looking at kind of where we are at the moment with the COVID-19 pandemic, what impact that it's had on the locum and sessional workforce, but also what's key is what is actually next for us as locums, like what can we look for in the very near future, because most of us actually want to do less of thinking about the problems we've faced over the last few months and think more proactively about what is it that we're going to do and what does the future look like for us and how do we prepare for it. And I'm going to share some useful resources which we're going to collate at the end and send out to you as well. And obviously feel free, as James said, to post your questions and make sure this event kind of caters for what you're interested in and what your needs are. Okay, so a bit about the current COVID climate. So one thing I wanted to say is that the content of these slides is a collation not just of me and other locum GPs experiences, but also kind of input from practice managers and practices and COVID hot and cold sites. So first of all, I think across the board, because of the pandemic, practices have seen a dramatically reduced patient demand across all services. And this isn't just general practice. You would have seen in the news A&E attendance has fallen by 50%, which is a record for quite a number of years. So across the board, across the healthcare system, patients are accessing healthcare less, which means demand, day-to-day demand has also dramatically gone down. Now, the side effect of that is that actually workload in practices has decreased. Not only is there less work opportunities for locums, but salaried GPs and partners, and my husband's a partner in a practice, you know, they've all been feeding back that actually it's been quite quiet and actually there's not been a huge amount to do because business as usual in general practice has been put on hold in order to prioritise a response to COVID. Now, the other issues that have exacerbated the effects for locums is that actually most practices are at full staff capacity, which is great news if you're trying to prepare the NHS for a pandemic and you're not sure how many patients are going to be affected. So partners like my husband cancelled his annual leave, salary GPs all hands on deck. And also with the introduction of remote working, it meant that those partners and salary GPs that would normally have been off sick or self-isolating and therefore unable to come into work were able to still provide clinical input through remote working. Now, on the whole, this, together with a number of other factors, has meant that a lot of us have seen a large reduction in the number of work opportunities that have been available to us during the COVID-19 pandemic. I think some of us were hoping to step up and take part in a lot of additional roles. What I would say as well, so through my locum manager, a number of the CCGs that were hard hit with COVID utilised the platform to send out remote sessions to locum GPs, telephone triage sessions to locum GPs, as well as face-to-face hot and cold site sessions. And initially, the expectation across those CCGs was that demand was going to be unsustainable and unmanageable. And thankfully, that wasn't the case. Actually, the demand and the number of patients affected, even in those high-hitting regions, was still very manageable, and even on the worst days they were still able to cope with the services they had in place. So that's great news in terms of what we as a primary healthcare system have provided, but I think the expectation on the other side was that actually we were going to be really, really busy as locums and have access to a lot of additional work and be able to support patients kind of to a much higher degree. But across the whole service, so for salary GPs, partners and locum GPs, the clinical input needed has been a lot less because thankfully our health service has stepped up, the demand has been a lot less and it's been much more manageable. Now, the other things which I'm sure we'll talk about in the context of the session is some GPs have had sessions cancelled, often last minute because of this unneeded demand. And I put T's and C's there because hopefully most of you had some T's and C's in place, but if not, I think that's definitely a lesson going forward about having some ways of protecting your self-employed income against last minute cancellations. There's also been safety concerns, which James and Azza touched on, about kind of having access to PPE and feeling like you're kind of being able to offer the services that you feel safe and equipped to offer. And I think we're going to talk about that slightly later. But what I would say is I think I've seen kind of a distribution. So I've seen across services, a lot of practices scrabbling, trying to get PPE in place for everybody, their staff, as well as their locum GPs. Other places not able to get hold of as much. And some places, I think, I have heard stories where some locums have felt like they're being pushed to all the high risk jobs. But in reality, all of us, even if we're doing cold clinics, we still could be seeing COVID patients who are asymptomatic. So some CCGs particularly the ones I've been involved in, have set up remote sessions for their locums, but everybody works differently, you know, and everyone's had very different experiences. But I hope that kind of gives you a foundation on what the current COVID climate has meant for us. Now, in terms of impact, what I've done is I've divided the impact that we've all felt, financial, emotional, all those kinds of things, into 3 different categories. So I'd say the locum groups that kind of generally work by having a direct relationship with practices, they know those practices over time, and they're their go-to GPs, have been affected like all of us have. And I think I probably fall into this category. I think this group of locums are in a much more protected situation than some of our other colleagues, because we know that actually going forward, as demand gets more and practices get busier, we'll be the first port of call to be invited back to do those sessions at those practices. So for now, like many self-employed professions across the country, we're having to look at the financial impact of reduced sessions, but we do know things are going to get better, you know, very shortly, and we'll be invited back to do our regular sessions. So the second group of locums are probably in a much more vulnerable position. So these are GPs that tend to be dependent on third parties for work, agencies or such like, and either they haven't had the time or they've not had the opportunity to build up their own direct relationships with practices, which means they're now in an environment where competition is much higher because demand for locums is much less, which means they're competing with a lot of other GPs. There's a lot of uncertainty, and they've often had a lot of mass cancellations of sessions when kind of COVID first hit, and going forward, practices have kind of really stepped back from kind of getting new GPs in or getting locum GPs in because demand has been less. I wanted to put the third category of GPs in because I myself have heard from a large number of these, and I think although this talk is about locums, I did want to kind of put the spotlight on new GPs or those due to CCT soon, because I actually think these are probably the most vulnerable of all of these groups that I've mentioned, because everyone else would have had a chance to build up a bit of an income, build up savings, build up a tax account, build up some kind of work. But new GPs or those due to CCT wouldn't have had the opportunity to link in with any practices or do some sessions. And now at the moment, to do the high risk hot clinics or out of hours, they probably don't feel as equipped for that. And also many of us, when we finish, we think we'll do a bit of locum work, but we might also do some salaried sessions as well. But because recruitment across the board is much lower, you know, practices aren't recruiting locums and they aren't recruiting new salaried GPs either. For this cohort, I think they're in quite a vulnerable position and probably feeling a lot of anxiety going forward as well. So I'm going to share some tips shortly about how you can kind of overcome those. Okay, so a few weeks ago, I did a webinar on My Locum Manager regarding COVID-19 and the financial relief available for self-employed GPs. And as part of that, we had done a national practice manager survey, because I understand, and I think we all understand, the difficulties locum GPs have faced, but I think we can probably all agree that we're really keen to look at how do we go forward and what is the future recruitment of locums going to look like. And in terms of the types of practices on My Locum Manager, essentially we've got thousands and thousands of them, and like I said, it's from across the UK, so I feel like it's kind of hopefully representative of maybe practices local to you as well as those local to me. So the first point, which I've summarised here, is that practice managers reported and acknowledged there has been a massive reduction in demand because of the reduced footfall and because patients not wanting to access or go to their GP. But many are noticing actually day by day that demand is increasing. And what's interesting is that demand isn't increasing with more calls about COVID-19 or a cough or temperature. The demand that they're seeing is actually the day-to-day bread and butter of general practice. So a lot of mental health, anxiety, lumps that they found a few weeks ago but didn't want to bother the GP or didn't want to come in or didn't want to kind of call and make appointments for, chronic diseases, diabetes, eczema. So all of the stuff that we're used to seeing is now starting to build up faster and faster, and all the practice managers said we're getting busier and busier by the day. Now, the other point that practice managers all mentioned is that actually the sessions that we as locums will be seeing in the future will be different. They'll be mixed. So most of them have offered digital consultations now, or triage or video or phone consultations, and they're saying actually for the foreseeable future, because of the COVID-19 risk, health risks to patients, health risks to GPs, and also the demand for patients now to be able to just phone or have a video consult, it's likely that our sessions will be a mixture. So we'll be doing some telephone consultations, some video, and then some face-to-face within the same session as well. This asterisk is there because I think while it's quiet at the moment, there's so many free resources on remote consulting, video consulting, and how to do it effectively, because as GPs, we've all been trained, even if you're newly qualified, mainly for the face-to-face, picking up behavioural cues and putting your hands on the patient. But going forward now, this is changing for all of us. And although indemnifiers have now said that obviously if we make a mistake, we're covered kind of because of the COVID pandemic, going forward, that's not going to be the case. So there's so many free resources out there. Ian mentioned the RCGP. There's lots and lots of free resources out there to get up to speed and get used to this new way of consulting. And that's just one of the things you can do to prepare for the next few weeks and months as you will get busier with sessions. The other thing practice managers fed back on was demand versus supply. So they said this change in digital provision for their patients has meant they actually feel much better able to manage the demand that's been coming through their door. So what they felt was actually, whereas before they kind of needed locums, you'd come in, the practice would be really busy, you'd see your patients. Now they feel like actually the demand, they're going to be able to manage the demand much better through these different avenues, which means as locums we'll be still having enough work, but I don't think there's going to be a huge excess of work going out to agencies or third parties. I think actually most practices will be running a lot more efficiently. And I know from all the ones that have fed back on the survey, none of them are going back to full face-to-face with none of these other digital tools. So I think it's definitely here to stay. And I think it will definitely make our jobs a lot easier going forward. So the third thing that one of the questions on it was about the need for locums and should we all worry and panic and stop being locums. And actually, I was very reassured to see that the majority of the practice managers said, you know, we're always going to need a good locum GP and they're always going to be in demand, which is really nice to hear. The other thing that they mentioned was actually they feel that because government policy that's coming in for employers, they've got to make sure that their employees or their self-employed, whoever's coming into their practice or their shop or their business is not at risk of COVID. The businesses have taken enough measures to make sure whoever's working in that environment is kept safe. There's going to be more of a drive to get a regular group of GPs coming in, you know, to offer the sessions rather than a different GP every day. And that's simply, a lot of the practice managers said, because of practicalities, safety, induction, showing everyone where the PPE is, training. They just want to keep some consistency going and make sure that they've ticked all the boxes with regards to safety and making sure that both parties are working as safely as possible. They also mentioned a lot of them have been doing workforce planning currently, and they mentioned that a lot of their partners and salary GPs have been working flat out for almost 4 months now because of the COVID response. All annual leave was cancelled, and those GPs are getting very fatigued, and many of them are looking to book leave now or in the very near future, and we all know a second wave is coming. So I think, you know, as locum GPs, we will definitely have our opportunity to offer the kind of help that we feel comfortable offering going forward. Some practice managers laughed and they fed back on the survey that, look, you know, things haven't changed. We've still got X many pregnant GPs who are taking their maternity leave soon. We're still going to need long-term cover. So, you know, don't worry, we'll be accessing our locums soon. Another couple of points. So many practice managers said, actually, it seems like a lot of us locums have been very proactive and have been emailing or calling our local practices who we hadn't connected with before. One practice manager had said after 2 years of like a virtual desert, they've had 10 applications from local locums in the area directly to their inbox, and they found it very personal and very proactive. And they said, actually, now we've basically sussed our workforce now, so going forward I know exactly who I'm going to be connecting with. The last thing I wanted to mention was they talked about salaried posts, because some of them said that, look, although we're not actually advertising, so those people who are due to CCT soon and might be worried about, you know, getting access to these salaried posts or locum posts, most of the practice managers said, look, we're not actually actively advertising, but we're still open to recruiting. So if people are interested, definitely contact us and we can start the conversations. Okay, so just a quick summary of concerns. So we've shared a few of the concerns kind of in the opening of the webinar, but generally I think a lot of people worried about stability, income, safety, financial impact, worried about getting work going forward after CCT, I know many GPs that contacted me directly were worried about their health because they had health conditions, so they felt they weren't able to see patients face to face, so they were wondering, you know, how were they going to work going forwards. And what I wanted to kind of share about kind of COVID and the pandemic is this current situation. We've never had a pandemic like this. It's unprecedented, but it is temporary. And I think the main learning point that locum GPs can take forward is about protecting their livelihood, working with autonomy and safety, and maybe thinking about building relationships where they want to work. If they don't want to do face-to-face sessions, looking at how they're going to make that happen from a remote aspect, and making sure that they develop that stability going forward. Okay, so on to a few resources. So in terms of those of you that were asking about where do I access work, what do I do? So you can contact practices directly, like, you know, if you want. NHS Choice is a brilliant website if you just want to find a local list of those services near you. Contact them, and then as they get busier, be their go-to GP. Out of our services, most of them are recruiting directly. I think anyone going through an agency, you're up against another 10, 15 GPs, so you'll just be at the back of the queue. You could just Google out of our services, Ken or whatever, come up with a link, click on, they've got a recruitment email for pretty much every single one of them, and just send them your details. I wanted to mention very quickly the COVID Clinical Assessment Service. So this has had a lot of mixed feedback. So this is kind of NHS 111 service for the COVID response. And the feedback, so they've recruited up to 1,000 GPs now. They've seen or consulted with about 37,000 patients and done over 2,200 sessions. And I've had really mixed feedback about it. It's like some of the GPs doing it love it. It was initially offered to returners, and now locum GPs have been recruited in the last few weeks. The pay levels are a lot lower than what you would get in a locum session, but I think if you're looking for work and remote work and building up experience, it's a good option. The setup and onboarding is slow. You've got to go through their own training and their own validation procedures and get set up with the tech. But their sessions are 24 hours a day, 7 days a week. So I think if you're interested in it and you're prepared to wait and go through the onboarding process, it could definitely be a good option for you. Okay, so second set of resources, I'm going to talk a bit more in detail towards the end of the webinar, and they're going to be shared with you, but just a few kind of things to share with you. The NHS England helpline is available kind of for all of us who want to access support for mental health. The Sick Doctors Trust helps support doctors, particularly those with drug or alcohol problems. Doc Health is a confidential not-for-profit service, which is supported by the BMA. And RCGP have lots and lots of COVID resources and lots of links to mental and emotional well-being. From a financial point of view, as I said, we did a COVID webinar, happy to share that with you with a PDF for tips. The HMRC have a really good link on the self-employed support scheme for locums, where you can claim a proportion of your income back for COVID if it's been affected by COVID. There's certain criteria you have to fulfill. Those of you that are working as limited companies or earning over a certain 50k threshold, you're all entitled to the bounce back loan, and you're all entitled to mortgage relief, relief of car payments, and lots of other resources which I've created in a PDF which is going to be shared. For those of you that are really suffering financially for your own personal reasons and you need additional help, I definitely signpost you to the Cameron Fund, Royal Medical Benevolent Fund, and the Royal Medical Foundation. You can have a look at them, but they're there to support you all in your challenges. And I think most of you have given so much of your time and care for your patients. If you need that help, it should be there for you, and it definitely is. So please do access it. Great, so that's my bit done.
Well, thank you so much, Surina. That was really wonderful exploration. And sorry that we've had to go at such a pace.
Sorry, I was talking really fast.
No, absolutely.
Cutting into Richard's time. I'm so sorry, Richard. I talked as fast as I could.
There is so much information there, and it's really, it's really great. We got through so much. So without further ado, I'd like to hand over to Dr. Richard Fieldhouse for the next of our wonderful panelists today. So please, everybody, welcome Dr. Richard Fieldhouse. Thank you.
Hi, everyone. Thanks so much for having me on this today. So I'm Richard Fieldhouse. I'm a GP locum. I've been a GP locum for 25 years. I was a partner for 6 months, but I don't want to talk about that. I've worked in over 100 different practices. I've some years I've worked in over 30 practices a year. And when I qualified as a GP, when I did my training, I was trained to be a GP partner or a salary GP, as we all were, but received just little or no mention whatsoever of GP locuming. So began locuming, immediately found it really isolating. I was really quite shocked. I thought, what on earth is happening here? But I still carried on my regular monthly meeting up with my friends from training. We set up a locum group. We chatted about work. It was really nice, really tough weeks at work in all these weird and wonderful practices that definitely were not training practices, that were desperate for locums, all sorts of issues. So we used to unwind together, and I thought, well, actually this really works. And at the time there was no such thing as BMA sessional GP subcommittee. The college weren't doing anything for locums then, and I thought people really need to know about these locum groups. So I got a bunch of other locums together and we started off the NASGP. And also at the time, there was no such thing as pensions for locums. There was no website, there was no handbook, there was nothing. So the first thing we did is we started lobbying for NHS, for pensions for locums. And we as NASGP got that, which we're delighted with. And over the first 5 years, we ticked off lots of achievements. But having got a handbook going, there you can download free from the NASGP, 40-page handbook on how to work as a locum, completely free. We website, pensions. We started a practice pack, an online standardised locum practice pack, which we still have. We give that free to practices as part of our locum deck platform. But after 5 years, having ticked all those boxes, we still wanted a way forward. We still wanted something that was more proactive, more constructive, that actually tackled locum isolation. So the Royal College gave us a whole suite over one very rainy Saturday, and 35 locums and 35 new locum groups from around the UK. We all met together, we brainstormed, and we came up with a locum chambers model. So a locum chambers is the opposite to an agency. A locum chambers is like a cooperative, a collaborative. It's a local team where locums come together under a shared umbrella where they pool all their professional resources together, and that helps them pay for a chamber manager, a chamber lead, and a clinical director. And we got those up and off and running, and in the last 6 months now, NASGP has now, whereas other people have started up their own different chambers on the south coast and up in the north, across Yorkshire, we as NASGP now launched our own types of chambers across locum deck as well. And some we're doing for big CCGs across Oxford, Berkshire, Buckinghamshire, all of Norwich now, Essex, and we've got other local locums who've asked us to set up chambers for them in Surrey, southwest London, southwest Thames, Worcestershire, places like that. So it's really starting to take off. We're interviewing about 3 or 4 new locums every day to join these chambers. So I've been asked to cover a few things, and I've woven those into sort of some sort of hints and tips, which I think are quite sort of apposite for this current climate that Surina so beautifully laid out of what's happening now. It's a time when those of us who've been locuming for a long time are sort of really reflecting on some of the things that have been happening: abrupt cancellations, lack of PPE. We've had stories of locums being the only ones seeing face-to-face patients, all that sort of thing. So it's really come to the fore. And we've actually also done a bit of, we launched a piece of research last week as well, a survey, which I'll talk to you about. But so the first thing really I want to say is about my top tip really would be about you now today as locums. You've done your training, or you're doing your training, little or nothing about working as a locum. So you may not be something that you have chosen to do, or it may well be something that you want to do, but whatever it is, when you're locuming, think of it as a positive career choice. It is already for many of us. It is a great career option. Sure, you don't get all the stuff about continuity, but what we don't talk about is as a locum the ability to practice in a diverse way, about getting access, about getting a second pair of eyes, about having a very broad spectrum of practice in all sorts of different areas, rather than in a very specific sort of deep dive of a practice. as in diving practice. I mean, as in, you know, it's about having a very broad knowledge of a local area. So, and on that, my other tip would be that be the best locum that you can be, even if it's not what you currently want to do at the moment. When you get up in the morning, you're who you are. You've got your family, your friends. But when you start working, when you start thinking about doing some education, some learning, or going off to work, think about your stepping into your other role, your doctor role. It's difficult because, again, as I say, we've not been trained, we've not had practice at doing this. And it's difficult to actually start all of a sudden doctors working from home, because actually our home is actually our place of work. So think of yourself stepping into like an exoskeleton, like almost like a mech warrior suit. You are a valid legal business, whether you're a sole trader or a limited company. If you happen to have set yourself up as a limited company, you have exactly the same legal rights as any high street business. And it's thinking of yourself in that way. So you are your own chief executive, you are an entrepreneur, you are your accounts team, your management, you do the finances, you're about sales. And it's about sort of deconstructing what you do and doing everything you do in as a professional way as possible. And when you are making decisions, for example, like taking on an accountant or doing your accounts, for example, don't try and do it yourself. Do seriously consider using an accountant, and just not any old accountant, but use a specialist medical accountant. They might cost a bit more, but they're much better value. Working as a locum with different limited companies, sole trader, with IR35, working in the public sector, with NHS pensions and the tax relief on that and all that sort of thing, you do need a specialist medical accountant. And the same goes for financial advice. Get a proper independent medical specialist financial advisor. As a locum, you can get sick pay. You absolutely can get sick pay. Any business in the high street can take out an insurance policy, and you as a locum can buy an insurance policy for sick leave. They cost about £500–600 a year, but that's what a business would do. And think of it in that sort of way, to have that business resilience, and so that should you go off sick, you've got that built in. Work on yourself as a business. Don't think about when you're going out to locum as though it's me, Robert, Richard, whatever, going off to it. It's you as the limited company or as a sole trading entity. Think of it in that way would be my advice. Things like death in service, again, which has really come into the fore as well. Death in service is an anomaly in the NHS pension scheme, that it means that you, as a locum GP, you actually have to be, I see a massive spider outside my window. As a locum GP, you actually have to be at work in service. You must die at work, basically, to say your family gets death in service. If the GP partner in the room next to you is your same age, has done the same amount of NHS work as you, you both die on the way home, their family will get about 200 grand, yours won't. But effectively, death in service is a life insurance policy, and you can buy life insurance policies really for not that much money. So it's another business expense. It's one worth seriously considering, and it removes all that existential angst about not having a death in service cover. It's a life insurance policy. Other stuff, when again, in any serious business, when it's organising its sales and your bookings and all that sort of thing, always have an audit trail. Do everything in writing, do everything in an email, or use a good robust IT platform like My Locum Manager or NASGP's Locum Deck. Locum Deck's got built-in terms and conditions baked into every confirmation email, every booking email, every invoice. It's all in there, and it's all tailorable to your however you want it to be. But should something happen, should you get a cancellation, you then have got your cancellation terms and conditions. Caveat there is that what we're hearing is it's, and you're probably thinking this already, that as an individual locum, it's actually really hard to enforce your T's and C's. We as GPs tend to be kind of caring type people who don't get bothered about negotiating and that sort of stuff, and confrontation. We don't like that sort of thing. It's not the type of temperament that goes into general practice. And we come across some quite sharp practice managers, and often those cancellation policies aren't implemented, which is where things like the chambers really come into their fore, because if a practice ignores the chambers cancellation policy, they're doing it for all the GPs. And actually then you've got the chambers and the chamber manager and the chamber clinical director, who will be you or one of your locum colleagues, will have the back of everybody else. So having that resilience baked in, built in to everything you do. Another tip, WhatsApp. It's not a professional platform. It's a social tool. It's a texting system. We shouldn't be using things like WhatsApp to get work. It gives far too much power to practice managers. Nothing wrong with practice managers having power, but it's asymmetrical. And again, what we're finding with all these interviews we're doing for all these locums joining the chambers, a lot of them have been talking about how it's driven pay right down, how practice is setting rates, how practices are refusing to pay pension, and they can do that because of this asymmetrical nature. And stories even of locums who a few days before a booking at a practice receive the WhatsApp message for a session that they're going to be doing, to find half an hour later they've got cancelled because the practice has found someone cheaper. We should not be letting ourselves fall into that trap. Use professional systems, and not to use things like WhatsApp. And of course, if you're doing bookings through WhatsApp, you're not getting the proper terms and conditions and all of that. You wouldn't book a babysitter with a WhatsApp if you know, in the same way that you would book a locum. So we shouldn't be using it. We hear a lot from our practices. Because with Locum Deck, you upload your credentials, and then practices, if you allow them to, have got access to all of that. And what we hear from practice managers is your CVs. They really love reading the CVs, because everything else is fairly sort of standard and boring, but a CV tells them about you, and they find them really important. And the feedback we're getting is some are beautiful and beautifully laid out, and that's really appealing, but some grammar, some spelling, they get printed out on a practice computer and the edges are cut off. If you've got some time, go through your CV now, check it with some friends, send it to a few people. It's really worth doing. It's so important, and it's about how you are perceived out there. Now, that survey I mentioned, so we started this off on Friday. We sent it out. We've got 4,500 members in NASGP, GP Locum members, and we've just had over 250 replies. And we were looking at them a bit earlier on today. And what we've done is we have asked, sort of to get a benchmark, we've asked locums, you know, where before COVID, how were you working? What did you like? What did you like doing? What did you, how did you do lots of group learning? Did you find that you as a locum were able to assert influence on practices you work in, and CCGs and federations and that sort of thing? You as a locum, were you getting support? Were you able to give support to other locums in your area? Did you want support for complaints, backup for cancellations, all these sorts of things? And we've got people to rate those with a Likert scale. And then we then asked them, going forward after COVID, when things are back to normal again. Somebody the other day called them the COVID holidays. I didn't know whether to laugh or cry. Anyway, but after COVID, what do you want? And what we're finding very, very strongly is there's a big tilt in all these 12 areas that we asked towards a much more collegiate way of working as locum GPs. They want more group learning. They want more support for complaints. That's my timer. James got it before me. A big shift to more sort of team-based, collegiate-based working, support from each other, working together. Big thing with chambers, I just want 30 more seconds, is social events, how important they're being perceived through the survey. And yeah, I'll stop there.
Thank you so much, Richard. That's been a really interesting talk, and thank you for sharing that wisdom with us. So now we're going to sort of open it to the floor for questions. We've had a few coming through during the talks. and please feel free to keep them coming. We've got around about 15 minutes, maybe slightly longer, to ask those, and we will put them to our panel. So to kick off, we had a question early on, and I think I'll put this to both you, Richard, and you, Surina, too. So there is somebody coming to qualification in August, and there's some trickiness around that at the moment in respect of how people are about exams and who is qualifying, but they're wondering about how they might go about finding locum work as a first-time locum, and have you got any suggestions for that? Should they be considering agencies, or is there any way that we should that they should be approaching it?
I would suggest that this is something you should have had in your training. It's so important, because resilience is about having that foundation of work and all that kind of thing. But obviously, things I've mentioned, agencies, you can use agencies. And agencies tend to slap a 20-30% fee on top of the actual rate. So the practices are paying a lot more than you're earning. And if you can get away with that, agencies tend to redact CVs when they hand them over to practices. Practices complain about not being able to give feedback to locums. You get exclusivity clauses. You get some agencies and online big online booking platforms have exclusivity contracts where if you then go on and get a partnership or a salary post in that practice, or some of these online mega agencies, in any practice in the CCG area, they can slap a 15% fee on your annual salary for a whole year. So I think, as Surina is saying, you use your autonomy, and you can use that as an individual, or you can use that as a collective. If you've got a locum group in your area, and there's over 100 locum groups around the UK, there's fast approaching 30 to 40 locum chambers now across the UK in various areas, but try and network up with other locums if you possibly can.
That's really interesting. Is that something you'd reflect, Surina? I think, to be honest with you, I think we're all so different, and it's not one size fits all. So there's so many different ways of finding work. I think when you're finishing CCT, often you want that experience, but you're quite nervous, you've never done it before and you don't know what to expect. You don't want to get taken advantage of. You want to do the best by your patients. So I say there's so many different ways of finding work, and there is no currently we're in COVID, and yes, work levels are low, but there's really no shortage. I'd say the way I felt, and I'm only kind of coming up to my first 5, so I know how it felt like finishing CCT. And I'd say, touch base with your training practices on your VTS first. Just ask your administrator, email out your CV, and connect with them first, because training practice caliber is a lot higher. You can speak to, it depends on the area. So, there's so many different agencies, WhatsApp groups, connecting directly, using platforms, so many different ways. But I'd say if you're finishing CCT, you're going to want a bit of a supportive environment. Just simple things, start around with your training practices. Most of them guaranteed will have you for a few days. Once you start building up a bit of confidence, you can try all these different methods. And ask your other kind of the STs that finished the year before you. But I think have a variety. Don't be dependent on one particular source, and try and build up some autonomy. It's really exciting on the other side of CCT. It's just making that little jump. And I know for me, First 5, and I do a lot of work with First 5 groups kind of up and down the country, but the RCGP First 5 has a lot of resources and a lot of connections, so you can build that social network. But I just say, do whatever fits with you. But my top tip would be just start with your training practices first, because they'll support you along the way, and then they know other practice managers, and you can just then try whichever way you want, but at least you've started in a nicely supportive way.
So what I'm hearing from both of you is using the networks that you have already, and looking at the way that you can be supported with people that you're already in contact with to help carry you through that. Thank you very much for that. Hand over to you, Azza.
Mummy's coming. Sorry. Don't even hit my son. Mummy. Sorry.
Oh dear. Right, so the next question that we received, I think it's for you, Richard. It's asking about, is there any chambers covering Leicester?
Leicester, nearly. We've got an area very close to you who we're talking to at the moment who want to get a big chambers kick-started off there. But if you haven't got a chambers in Leicester yet, we can easily start a chambers for you anywhere where you are in the UK. We centre it around where you live. We've got utilise the NASGP database of 4,500 members. We'll let all the locums know in your area that someone is interested in getting one up and running, and then we then start to coordinate and link people together, get you meeting up. We're currently, normally these chamber meetings happen once a month. Currently we're doing them weekly now on Zoom. So we have every Monday or Tuesday night, we have all the locum members get together on Zoom. We have a national Zoom meetings, but we also have the local individual area chamber meetings on Zoom as well. So if there isn't one, they're relatively simple to get up and running.
Oh, that's really fantastic.
Azza, there should be First 5 groups in the area they can link in with as well.
Absolutely, yeah, I believe so. In Leicester, I believe we've got our representatives there, so we might link, if you wish, ask them to direct messages, and we will be able to connect you with our lead over there. Yeah, sounds interesting, Richard. Thank you very much for this, and actually encouraging for the rest of the GPs nationwide to build up these chambers as well and connect with you and also with Surina. I think I'll hand over to you, James, for the second question or the third question now.
So a question that's often been asked across the forums, and something that people do wonder about quite a lot during this, is how you stay, as a locum, how you might stay up to date with the changing COVID recommendations and clinical resources. Surina, how would you recommend someone might go about keeping up to date in a rapidly changing thing?
I think that's a really good question, and it's really important to keep your finger on the pulse. There's so many resources out there. I know for my Locum Manager members, we do regular webinars. I know RCGP has put out a lot of online resources. A lot of the education companies have got lots of free resources, and CCGs have been sending out all their local COVID policies and learning tips with regular Zoom meetings or regular kind of online webinars weekly often. So I'd say if you haven't linked in with your CCG, just drop them an email so you can get on the email chain, because all policies, no matter what the teaching is nationally, localized policy will be different, and what's happening locally will depend on, particularly your area. So it's important to stay up to date with that. So I'd definitely say linking with your CCG. Access the online resources, there's lots of free stuff at the moment. The RCGP COVID Resource Hub I thought was really good. The Redwell webinar on remote consulting has been brilliant. I've shared that a lot. Dr. Gandhi, I've got to give him a massive shout out, because his resources not only have me on the floor, like his poor website manner YouTube video, but I just think it's brilliant the way he delivers stuff on how to do online consulting and how to prepare in this current climate. And they're very easy watches. So he's on YouTube, and I'm sure Antoinette can share his links. I know he's a Nottingham boy, so you probably are aware of him, James. So he's been really good. So I think there's lots of resources everywhere. Actually, we did a COVID financial webinar on My Locum Manager, which I can share with you guys, about all the financial support that's available and how to tap into it. So there's so much available. And I know Richard's probably got loads of things as well on his website. So I think everywhere and anywhere, everyone's got together to try and share these resources and try and make sure everybody's up to date.
Fantastic. Another question that's come through is particularly about people on maternity leave and working locum work around their maternity leave. Would you guys have any suggestions about how people might approach that, either coming into this workspace after maternity leave or trying to maintain those relationships perhaps going into maternity leave? With the COVID flavour, or just in general, I think is a common question.
Yeah, so I mean, I can answer this having recently.
You'll be better answering this than me, yeah.
Doing the maternity side. So I think there's a couple of things to think about with maternity, and one is the educational side, so staying up to date while you're off, because you'll be off for maybe a year, maybe a bit longer. And I found it really useful just doing some update courses, and you can do all them all online, whichever provider you choose, I also found it really useful when I went back to practice to do longer catch-up sessions. And for my kit days, my keep in touch days, which whoever posted about maternity leave will know about, I did 10 keep in touch days before I returned to work, and I used them as a time to like go back to the practices, do some learning, see some patients, ask questions, and basically put that all together to take things forward. I know remote consulting is probably going to be quite an important thing for those who've got little ones and maybe are worried about COVID and their exposure to COVID. And I think, I mean, we've done some pilots in and around London with sending out remote sessions to regular locums across practices through CCGs, and that's been working really, really well. But for that, you just need the IT setup, and if you link with your CCG, they can help you with that, and the way in which to deliver those consultations online. And like I said, there's lots of free resources because it's definitely a bit of a different skill. The last thing I'd say is I usually did my sessions around like nap times and feed times and things like that. So you can just speak to practices about what would work for you and what would work for them, and start doing that a few months before you return back to work. And my last thing would be baby brain. For those of you that had kids, definitely exists. So just going back a day before and getting your IT set up, passwords, refreshing yourself on the BNF and things like that are really, really useful.
Fantastic. And that seems like good advice for anybody returning to work as well, to actually get yourself reintegrated. Hand over to you, Azza.
Yeah, so I've got another questions. It might be for both of you if you wish to answer. We've got it. When you are deconstructing how you do your business, how are you own marketer? How do you promote yourself? Can chambers or other platforms help here?
When you work as a chamber locum, for example, the chambers that I know of and the ones that we run, and there's a camera, I've got a big box full of the stuff here, is all our locums get proper name badges, door plates, A5 profiles with their picture, sort of for patients. They get proper business cards, we get properly printed, branded brochures. And each of these local chambers have got their own kind of local identity. And the idea is that because all these locums, although it's still all self-employed or limited companies, the chambers or the co-op acts as an umbrella for them. So they're sharing their reputation. So when you're new to an area and something like the 50 to 60% of locums working in chambers actually either don't move away from the area or actually move to the area to be part of the chambers. They've got an instant shared identity. They're instantly kind of known for that collective ethos, because they work together, they share education together, they have similar standards, they got the same backup, the same chamber manager or managers on the phone for practices. And you've got the chamber managers who are out there helping you get work. They're supporting you with bookings and all of that. But they're also, those chamber managers are literally driving out to practices outside of COVID with some donuts, coffees, going around, chatting to practice managers, establishing long-term lasting relationships and rapport with the practice managers, so that when a practice manager goes to needs someone, they sort of go to their friend. My mum actually was my chamber manager when the chambers I set up 10 odd years ago. And my mum's Dutch, and I went round her house at Christmas, and she had all her Christmas cards all on the wall, but there was a great big stack of Christmas cards. And I said, Mum, why haven't you put those up? She said, oh, she talks like that. Well, they're from the practice managers. And I couldn't believe it. My mum was getting dozens and dozens of Christmas cards from practice managers who had the time to write these Christmas cards to the chambers. So appreciative are practices of the chambers and all the organisation that goes around them. That's kind of your brand, and that's what you're part of when you're part of your local collective. That is a massive sense of ownership and a sense of belonging. But that is kind of your marketing type, sales type engine.
And I think for those, because there's a lot of areas where there's not chambers or people don't want to work for chambers. So if you can just contact practices directly. You can just, honestly, once they start knowing you, you don't necessarily need all that paraphernalia. I think there's lots of different ways of working. So I just say start emailing. I've seen the questions about, I'm finishing soon, I don't know what to do. I think there's so many different ways that just maybe explore what works for you, link into your First 5 and your local chambers and your local locum groups. But there's so much support available, and just start connecting with people that you like and practices that you build a rapport with, and just see how exciting, you know, kind of life on the other side is.
Oh, that's fantastic. I think we've benefited a lot from your wealthy knowledge and experience today, Surina and Richard. Thank you so much for this. I think we've just gone past the 8 o'clock, and we still need to wrap up a little bit. So we've got a few sort of resources that we would like to share with you. And I believe Surina and Richard would like as well to share some of the resources. So they can, I think they're going to send it to our representative, our admin team, and they would be able to share with the participant. So we've got the COVID-19 forum for the RCGP, the First 5 platform as well, lots of wealthy and resources over there, and actually you can benefit from our colleague who was asking about First 5 in his area. Is basically he can find out who is the lead and try to email or contact directly from there. We've got our Twitter, and obviously for the COVID-19, the government website. Just going to hand over to James.
Well, so thank you very much. So I think all is left is to thank our panelists for today, Dr. Richard Fieldhouse and Dr. Surina Chibber. It's been a really fantastic look through this, and I'm really glad that this is that we've been able to bring this to you. Now, hopefully this has been helpful to you, but we really need your feedback, and we'll take everything back that we've had from today, and all of the questions and anything that goes onto the forum. Please connect with us, please connect with the college. We are here to support you. We're here to do everything that we can for you and put on more events like this as well. So please reach out. I think all it remains to say is goodbye for myself and Azza and our wonderful panelists.
Bye.
Thank you very much.
Bye-bye.
Bye-bye.
Thanks so much.
Thank you.
Thank you for joining us, and take care of yourselves, everybody. Keep an eye out for further events in the series, which we'll be looking at developing, and we hope to see you again soon at one of these events. So thank you so much. Hoping to try and keep mostly to time. Good night to all. Thank you very much. Goodbye.
Bye-bye.
Bye.